on the job due to the COVID-19 pandemic. So today we want to focus on how healthcare professionals can avoid feeling burnt out and seek help. We now welcome back Dr. Jasmine Singh, a resident in the UCSF Fresno Department of Psychiatry. Dr. Singh, thank you for joining us. We'd love for you to start by explaining why healthcare workers might be facing burnout at this point, or potentially even something worse than that. It's been now really a couple months since this all started.
Right. So medicine is a very high-risk profession. Physicians, they can be giving out multiple really, difficult diagnoses to talk about. They may be making high-stakes clinical decisions, and this is really all medical personnel, not just physicians, but speaking as a physician, doctors make high-stakes clinical decisions multiple times in a shift, which actually may be life or death, and they may be making them very rapidly, or a patient could remind them of someone they love, or like a child, and to see them suffering, it can be very difficult. And there's just so much surprise. A patient may die unexpectedly, and so this is just regular medicine, and not even, during a pandemic, this is only amplified, and you don't know what's coming in the door, and you don't know what you're going to face that day. So physicians face all of this on top of just a lot of sacrificing their own sleep, their own time to eat, and maybe even time with their family. So medical personnel, it's really a difficult profession, but we really owe it to them and to thank them for what they do for us.
Well, that's absolutely true. You're so right about that. What tips do you give these frontline workers concerning their mental health? And obviously, none of us really know how long this could be going on. This is something that may continue definitely for weeks, if not months. So what tips do you offer so that people can, these important people in our own community can get through this?
So if you are a physician or a nurse or anyone in the medical field watching, or if there's someone who is a doctor or a nurse or anyone else in the medical field who's watching and working during the pandemic currently, please think about your mental health. Doctors specifically have the highest suicide rate of any profession, and that rate is double that of the general population. And female physicians are more likely to die by suicide than male physicians are. So this is a very serious issue. Mental health care for physicians is very important and can be life-saving, just like any other medical treatment. So please seek medical and mental health treatment when you need it. Think about getting set up with a psychiatrist, a therapist, and really pay attention to yourself and your symptoms.
What would you anticipate once this pandemic is over? Would you anticipate some form of PTSD for some of these healthcare workers, where they've dealt with so much loss and compounded as you were describing? Is this something that could have some type of long-term effect on our hospital workers?
It definitely could. This pandemic can be traumatizing, especially for physicians. Not only are they seeing so much death in the hospital, their own sense of safety and life can be threatened. They don't know if this next patient they see could be the person that gives them COVID-19. So yes, I think the possibility of PTSD is very strong, along with anxiety and depression and basically any other mental issue. So it's very important that there be awareness and medical personnel seek treatment.
I know the community has offered support in many ways. We've seen food deliveries and car parades and that type of thing. Is there anything more that the community can do to really show our hospital workers, doctors, nurses, and all the hospital staff that we're thinking of them and we support them?
I think there's been such a great increase in that kind of gratitude behavior towards medical personnel by everyone who appreciates them. I say, let's continue that. Let's not stop when the pandemic is over. Let's always appreciate our doctors and our nurses who sacrifice their own time, their own well-being sometimes sometimes, and sometimes even their own life, to help others and to help all of humanity and heal them. So let's not forget their sacrifice. Let's only continue to thank them and appreciate them as much as we can.
Dr. Jasmine Singh, resident at the UCSF Fresno Department of Psychiatry. Excellent point, and something that we all need to remember. Thank you for your time today. We appreciate it.
Thank you for having us.